Hi, I'm Dr. Steve Gallop. I'm a behavioral optometrist, and I wanted to talk a little bit about vision therapy. I've been practicing behavioral optometry for over 20 years, and I specialize in providing vision therapy for people of all ages, between the ages of 2 and people in their 80s. I include in those patients my daughter, my father, and one of my brothers. Actually, I was a patient myself of a behavioral optometrist when I was an adult, already an adult. I had a vision problem for most of my life and didn't realize it. And it really, even in my 30s, the vision therapy was very helpful to improving my ability to read and focus and do the work that I needed to do. Many people think that vision therapy is eye exercises. It's not eye exercises. Nothing could be further from the truth. The eyes don't need exercise. It's actually a series of activities designed to help train the brain to use the eyes more efficiently. The eyes are part of the brain, and we really see with our brains, not with our eyes. And that's what vision therapy is about. In my office, it's an individualized program based on a given person's particular needs. It includes in-office visits of therapy specifically designed for that person, and in most cases also includes a pair of therapeutic lenses that help stimulate the brain in particular ways as well. Now, there are many out there who claim that vision therapy is controversial and has no scientific proof behind it. Nothing could be further from the truth. There's much science to back up what goes on in vision therapy. Much of this science comes from outside of our profession. It comes from brain research and neurobiology and other related fields that don't even know that vision therapy exists, and they certainly don't know what it's about. And yet the research they do shows that the ideas and the philosophy behind behavioral optometry and vision therapy are on very sound footing. So you'll see a lot of people are searching for healthcare on the internet using Google or any search engine, and the first thing you'll see if you type in vision therapy is a website that looks like it is a neutral site. It has actually been paid for. That's why it's on the top of the search list. It is not a naturally occurring website. It's been paid for to be at the top of the list. And this site is put out by people in the medical community who insist, after all these years, that vision therapy is nothing more than eye exercises that don't work. So as I said earlier, vision therapy is not eye exercises at all, so they're already off on the wrong foot. And their claim that it doesn't work or doesn't have scientific proof, those claims do not stand up to scrutiny either. So when you're out there looking for alternative forms of care for vision problems, whether it be a strabismus, an eye turn, or a learning-related vision problem, or developmental vision problems such as is often experienced by children on the autism spectrum, look more carefully into all the options available and be careful whose site you're reading. You'll certainly get biased opinions from both sides. I'm obviously presenting a biased view myself, but it's based on years of experience and my personal experience going through a visual training program myself. So if you have any questions, there are places where you can contact behavioral optometrists in general and specific behavioral optometrists. If you would like, you can go to my website, that's gallopintovision.com, and look at the information there and maybe contact me. I'd be happy to answer any specific questions, and I hope you find what you're looking for. Thanks.